In 1965, President Johnson enacted Medicare. Medicare is a piece of national health care reform that Kennedy couldn't get in, and Lyndon Johnson took on his legacy saying, this is what President Kennedy wanted. He wanted national health insurance. We could get Medicare. So now we've got Social Security, we've got Medicare. We have an employer plan system, we have unions bargaining it in. In 1971, and I know, everybody knows that President Obama put this through, it's going to really blow your mind. President Nixon introduced national health care reform, the probably most vilified Republican in history, based on an employer-mandated health insurance system. Does that sound familiar to today? The health care reform bill passed by the Democratic Congress, and I should preface on political, this issue is political health care reform. I don't care what your politics are, I don't care what mine are, this is political at its core. President Nixon introduced the exact same provisions as we have today. And for whatever reason, Republicans fought it, and for whatever reasons, Democrats said this is a great democratic principle. It's the exact same bill. Senator Ted Kennedy introduced a single national health care plan in '73. And if anybody read anything on Ted Kennedy right up until he died, he always said that the biggest mistake he made was not taking what he could get and instead pushing the single payer model. So we wasted 30 years on health care reform based on really politics. In 1974, ERISA enacted a self-insured exemption. Up until this point, you really had insured plans on a statewide system. Now you have a federal system and allowed employer insurance to take off on a self-funded model. Now President Carter called for national health insurance. This will sound familiar too. The economy became the focus and he was unable to pass it. In 1986, we passed COBRA. So what did we do? We took Medicare and took care of people at a certain age who weren't working. We have an employer-based system, and we tried to provide access to people who were out of work, but not in Medicare. In '88, President Reagan signed Medicare reforms, to which he promptly overturned in 1989. 1994, President Clinton introduced health care reform involving private insurers. He was defeated, he was called socialist, and led to the 1994 Newt Gingrich-led Republican majority, which effectively killed national health care for another 16 years. In 1996, HIPAA was enacted, and I always say if we couldn't pass national health care reform, we thought we might as well just keep the information private. I don't know what it did, but there it is. HIPAA is really a law based on those old movies like War Games or something where people hacked into things. It was all about that fear that our information is going to get stolen. 1997, CHIP was enacted. Now we're trying to cover children. We can't cover everybody, so we covered children, people out of work, people not working at a certain age. In 2003, we passed Medicare Part D, which helped us provide prescription coverage to people in a national system. And now as we get into '09, you're starting to see we've been inching towards this all along. This is not a new topic. This is nothing dramatic. It's simply moving to where we always wanted to be all the way back in 1912. Health reform, national health reform bills are presented to Congress in '09. We've got a number of bills, in fact, 5 different ones, which is why I say if you Google it, you've got a very good chance of being wrong. And then in 2010, Ted Kennedy died, probably the greatest irony in this whole history lesson. Scott Brown wins the election as a Republican. The Democrats lose their filibuster majority. And now it's forced to pass a bill that really nobody wanted, that looks a lot like the Republican bill, which is employer-mandated health insurance. And we pass it finally. So as we all talk about healthcare reform, and we all sit in this room because it's a really interesting new topic, and lots of people are talking about it, we've been talking about it for 100 years. And the good part of the story, and it's not to preach to you about history, is that a lot of the things are flushed out, we can guess, because we've been talking about it for a long time.